All right, we're looking this week at chapter 12, which is students with severe disabilities. In the history of disabilities, those that had severe disabilities often were segregated, way too often maltreated and kept in institutions. Um, these kinds of disabilities were it's beyond the capability, beyond the technological abilities of the folks, and they really did not know what to do with people who had such severe disabilities. Um, in the 1960s, rubella caused a great rise in the number of children with dual sensory losses, those who were deaf and blind. And coinciding with that, also during the 60s, was this whole idea of deinstitutionalizing, trying to go with the idea of normalization, trying to make these individuals have as normal of lives as possible. Many advocacy organizations got included in this, trying to seek inclusion in schools and communities for people who had such severe disabilities as in the past would have made them institutionalized. Because severe disabilities is not one of the 13 categories under IDEA, we don't really have a definition of under IDEA. But what we're going to talk about and what this book talks about is severe disabilities include multiple disabilities. Students who are multiply disabled. In Texas, we call that MD, or those who are deaf and blind. They have deafness and blindness. And of course, that's the DB label in Texas. When we think about this, multiple disabilities are concomitant or happening at the same time impairments. The definition, as we know, used to be mental retardation. Now it's intellectual disability and blindness, or intellectual disability and an orthopedic impairment. You can imagine, how difficult it is working with a student who is blind, but throwing that mix, someone who is intellectually disabled, and it's going to make it that much more difficult. When you think about people like Helen Keller, who's probably the most famous case that we know of, who was deaf and blind, how difficult it was to reach her. Not to be punny, but a miracle. And she was a brilliant person. So you can only imagine how it would be virtually impossible with someone who had very low functioning intellect. But these are concomitant impairments, the combination of which causes such severe educational needs that they cannot be accommodated in programs solely for one disability. When we think about students who are blind, if they have a normal IQ, and we've learned that often they can work extremely hard and the technology is available, that they can succeed. But not so with students who are blind but also have an intellectual disability. So when we talk about multiple disabilities, they're impairments that kind of piggyback on each other to the point that you can't treat them in a program that normally would be used for a student with just one of those disabilities. Deaf blindness is defined as hearing and visual impairments, the combination which causes such severe communication and other developmental and educational problems that they cannot be accommodated in special education programs solely for children with deafness or children with blindness. So it's a very specialized program. In addition, when we look at the prevalence, we'll find out it's very rare. So there's not a lot of opportunity to practice, to get better in this area. Classification can be based on AAMR levels of support system. Most students with severe disabilities will need extensive or persuasive pervasive supports. The AAMR is the American Association on Mental Retardation, and they look at these different categories of support. Intermittent needs support for some activities. That would indicate that there are portions, or there are some activities they can do without support. Time limited needs support during certain periods of time during life. Extensive, this is intensive support in one or more environments. And then pervasive, this is intensive assistance in more than one setting on an ongoing basis. It's like they must pretty well constantly must have assistance to make it. When we look at multiple disabilities, we're looking at about 1 in 500 students ages 6 through 21. And you know, that's a low number, but when you think about it, average high school, 1,500 kids, that would indicate that there's about 3 kids that fall under the multiply disabled umbrella there, but you don't see them in schools. Real often these are served in special schools for kids that are more severely disabled than what our neighborhood schools can take care of. Deaf blindness, this is also well below 1% of the school age population. And again, the treatments are so intense that you're normally not going to have these kiddos in your regular classroom. The exception to that might be if you're in a small school district far away from a big city. There may be no other options but to have these kiddos in the regular school. Again, in every chapter we look at causes, and in every chapter I tell you, not sure why we spend so much time worrying about causes. We as educators are not trying to fix it. We're not going to prevent it. What we're going to do is take care of the kiddos who come to us with these issues. But many of these are, you know, sadly preventable. Fetal alcohol syndrome. You know, if mothers just knew you can't drink when you're pregnant. Other syndromes and viruses and infections like encephalitis or rubella can also cause some of these severe disabilities with these kiddos. Environmental, this could be a trauma at birth, it could be a poisoning, it could be an accident. But we also are finding that there's a huge correlation with lack of nurturance, lack of prenatal care, lack of health care for the mom, early intervention or lack of early intervention could contribute to more severe disabilities. And sadly, some of these are the result of abuse, shaken baby, and those sorts of things that can cause all sorts of disabilities in many different areas. Therefore, the concomitant happening at the same time disabilities. So possible characteristics, and this is sort of like we talked about with autism, that there's such a huge range that you're not going to meet 2 that are alike likely, but some have diminished cognitive functioning that's affecting their abstract thinking, their learning, their attention, their memory. Many have significant physical health and communication needs. There are significant developmental delays. Some are, you know, elementary age or older and still not speaking. Certainly delayed social skills, if at all, behavior issues, and not generally the kiddos that I've seen, they're not generally behavior problems like we think of, where a kid is acting bad to try to get something or acting bad to cause you issues. They're just acting the way that they act, and they're not even aware that it's affecting other people. There could be significant motor delays, learning issues, attention problems, memory issues, mobility or lack thereof. So all of these things can, it seems like we've hit everything there. Well, you could. Um, and not every kid is going to have all of those, but every one of these kids that has one of these severe disabilities is going to have at least one, if not many or most of those developmental delays going on. They have difficulty learning self-care skills. For some of these, just teach them to brush your teeth is going to be huge. Need for a great deal of repetition to acquire skills. When you think about it, you're looking at a child that has all these other things going on, plus a giant intellectual disability. Um, so you may be looking at a 10-year-old that's operating like a 1-year-old or a 2-year-old, or um, some cases even less. So extremely difficult. I've seen kids that their IEP will be that they are working on how to take a spoonful of water and swallow that. So if you think that you think about that, their goal is to learn to swallow a teaspoonful of water. That's how low functioning some of these kiddos are. So normally not going to be a kid that's going to be in your general education classroom. If they are there, it would be purely for socialization. They're not going to be on the regular curriculum. So it's going to be, quite a challenge. There's also a difficulty in transferring and generalizing skills where they, you can teach a skill in one setting, but then you move to a different setting and they don't make the transfer, they don't generalize that skill. These kiddos are often identified at birth or shortly thereafter by the attending physician. Neonatal screenings and medical evaluations. So a lot of times you're going to know about these disabilities when the child is still very, very young. And schools through early childhood intervention and those sorts of programs begin to work at a very early age, sometime I start to say sometimes within days of going home from the hospital, sometime in the hospital, they will begin to work with parents and helping the parents to help the child. Communication disorders may be diagnosed by a speech language pathologist, but most of the time that is going to happen too before the child reaches school age. So we're talking about some pretty involved kiddos here. Common assessments, well, you may try to get an IQ score on a child like this, and that can help. That can help us know where we are, um, what the child is capable of doing. Uh, but again, it's going to take an assessment specialist, a diagnostician, or a school psychologist who has some experience in this area to even come near to getting a valid score. So it's not, not something that's typical, but they're going to try to get an IQ score because this is going to sort of help know what the potential is. And then adaptive behavior scales, these tell where the child is actually functioning in normal, what's considered adaptive behavior is in their normal kind of day-to-day life. This is not achievement like math and reading and those sorts of things. This is their behavior, their ability to do things that they need to do just to get through life. And there are dynamic assessments. These are ongoing assessments that help to kind of place where they are, what they can do, what they improvement over similar assessments that were done prior to try to figure out, what sort of trajectory are we on? Can we expect this child to rise, or is it pretty well that they're flatlined and not improving? All of this can help guide what sorts of decisions are being made as to what to do for this child. So for children with severe disabilities, what assessments can be used? Well, there are medical evaluations, there are communication evaluations, transdisciplinary evaluations, and assessments of family functioning. There are also, when we look at the IQ test, they're not going to be able to use a normal IQ test like a WISC or Woodcock-Johnson or something like that. There are tests of nonverbal intelligence out there that are designed specifically to use for people who do not have verbal language or much of verbal language. So these are the types of evaluations that are going to be going on to help. And it's all, none of this is to torture the child. It is all to help us try to figure out what the child is capable of doing, where they are now, and how to maximize or at least expand their abilities and get them closer to their potential. So when you look at deaf blindness, audiologists assess hearing loss at 40 decibel or greater is considered significant, while ophthalmologists or optometrists assess visual acuity of 20/70 in the best eye with the best possible correction. So if the child is wearing glasses or contacts or whatever, and the best we can get the best eye is 20/70, which would indicate this child sees at 20 feet what the average person sees at 70 feet, then that is considered low vision. So if you have a combination of hearing and vision loss that requires special education, this doesn't require that the child be absolutely legally blind or deaf. It just that they need to meet both of these thresholds. That's a 40 decibel hearing loss and a 20/70 visual acuity in the best eye with best possible correction. So that student can be considered legally blind and deaf, legally deaf blind, but still have some hearing and some vision. Some people think that this means that they're absolutely blind totally and they can't hear anything. But as we studied in the whole deaf and visual auditory impairment, most people who are considered deaf have some ability to hear or at least feel sounds. And as we saw with the blind, there are very few people who have absolutely no vision whatsoever. So this category reaches more people than we think of, but we're talking about a significant hearing loss. Oh, great, I've got a bug. Significant hearing loss and a low vision. So what should we teach students who have severe disabilities? Well, access to the general education curriculum should be available in early childhood and for school-age children while making those adaptations as needed. As we talked about, sometimes a student with some severe disabilities may come into an ordinary classroom, a typical classroom, for the socialization and for the idea of being able to see normal functioning peers and be around children of their own age. And with some creativity, you can be working on things that go along with the general education curriculum, even though the child may not be there. While you're talking about reptiles, the kid may be working on a color sheet of coloring a frog or something like that. So you want to, and of course, you as the general education teacher will be part of this conversation, but I can't think of any situation where a school would want to put a child with a severe disability into a general education classroom without having additional adult support. So, don't panic. Functional skills also will be needed and identified through ecological inventories, functional behavioral assessments, and alternate assessments. A lot of what's going to be worked on is not just the general ed curriculum, but also self-care and cognition, thinking about what they can do and what they know and what they uh, can learn. And then communication is huge. Motor skills, gonna practice um, walking, gonna practice using um, a wheelchair or whatever needs to be done in order to get around. Social interaction is big, and certainly we would like for that to include other students, not just working with adults all the time and socially interacting with adults all the time. But as these children get older and get closer to the age of 18, we want to begin to prepare for the transition to adult living. Most large school districts like Fort Worth and even ones that are not that big will have a transition program for students who have these severe disabilities that can teach them, even there's even some, depending on the disability and all, that could learn some, um, I don't know if you'd actually call it job skills, but some skills that they could use in a sheltered workshop environment to be able to be somewhat productive and have something to do during the day after they become adults. So a lot of times, as these kiddos will approach 18 years old, under the law, they can stay in school up through 21. So they're not going to, at 18, just put them out on the street. They're going to get them into one of these transition programs that will help them transition to whatever adult living situation that they are capable of handling, whether that be a group home or if it needs to be more severe than that, or more severe is not the good word, uh, more regulated, I guess would be a word, where they've got more assistance, more help, more adults who are helping in the day-to-day skills. Many of these kiddos, to be honest, stay at home. They stay with their parents. Um, in fact, you get into situations where what's going to happen when your parent can no longer take care of their adult child who has such severe disabilities. So all of those things are things that the school has to begin thinking about as the child grows into adulthood while still in the school system. So, how do I teach children who have severe disabilities? Well, any skill that they learn is going to require more time and more repetition. It's one of those things that just every day doing the same thing over and over, uh, to where the teacher needs to make sure that she's working with the paraprofessionals who work with this child, so that really the teacher could get burned out by boredom, um, as the child is trying to get the skills through thousands of repetitions. The instruction needs to be based on the student's needs. Here we, sure, the general curriculum's great, but that's really not what is going to drive this child's education. It's going to have to be adapted. Curriculum goals and objectives need to be adapted accordingly. Uh, Teach chronologically age appropriate skills. There's, in my mind, and from other people that I've talked to, there's some debate here. Do we teach? Do we not teach some of the, or not allow, maybe is a better thing to say, not allow some of the uh, age inappropriate skills just because the child is older. Let me give you an example. Generally, in schools, as children move from elementary age to middle school age, they no longer use crayons. All right. They use pens, pencils, computers. But what if you have a child who's 12 years old, but they have an IQ of 50 and they have a mental age of 6? You know, do you no longer allow them to use crayons? You force them to use an ink pen? To me, why? You know, what's the sense there? If they enjoy using crayons, if they enjoy um, being creative, why would you take that away from them? So yes, we want to work on chronologically age appropriate skills, but you know, I think some common sense needs to be in place as well. Discrete distributed mass trial teaching is one of the techniques that's used a lot. It talks about it in the book. We won't spend a lot of time going on that, but it's teaching where a lot of repetition and making sure that they master a skill before moving on. Providing for partial participation. This is what we talked about, where the child might be in the regular classroom. If there's something going on there that they might enjoy, it may be that in science class, the typical students, the general ed students, are doing a lab experiment, and maybe it has to do with balloons, maybe it has to do with fire. I don't know, but if that student can be involved in a safe way, they might enjoy watching what's going on. Now, are they going to learn the deep lessons that the other kids are learning? No, but they are partially participating. They're in part of the curriculum, and it's something that we're tailoring to them. We also need to make sure that we're working closely with the paraprofessionals and the families. The paraprofessionals are what we call the teacher's aides. A lot of times are the ones who are doing a lot of the hand-on work with these students, and so they need to be the part of the team, not just that we're telling them what to do, but they're able to help in the decision making and to be a part of everything that goes on. And we haven't talked about this a lot, but students with severe disabilities, some of them are still in diapers. So you've got when you think about adult size, high school age kids who are still in diapers, and generally it's your paraprofessionals who are changing those diapers, who are working with those issues. So it's not always pretty. We also want to work closely with the families. Many families don't have a good sense of what their child is capable of, but we need to work with them on that. We've learned that when someone has a child who has a severe disability, they go through a grieving process, very much like the grieving process of a person who loses a loved one, where they have to deny, and they go through all of these steps of grief until they finally accept it. And so we need to be there and be supportive and be loving and working with the child. Honestly, sometimes it can be difficult to continue to love and work with a child when the family can be so difficult at times. But we're talking, what an adjustment is going on with this family. And we may work with that child from 7:30 in the morning until 3:30 in the afternoon, 180 days a year during our school, but they have them the rest of the time. So keep in mind what the family is going through and what their lives are like having a child with severe disabilities. So what about the instructional environment? Well, students with severe disabilities and their peers without disabilities can benefit from inclusive education. We need to provide for peer interaction. And of course, when the students are young, we need to make sure that these are happening in positive ways and that, um, nobody's getting hurt and all those kinds of things. We want to use community-based instruction where the student will learn best. This might be a job site or actual public transportation, shopping venues, these sorts of things. We've talked about how things don't transfer well. So if you teach them to count, plastic money in the classroom, that's going to be very different than getting out into an actual shopping venue with real money. Provide needed supports in all the environments. And again, we're talking time intensive, we're talking personnel intensive, we're talking expensive intensive. Adapt according to sensory needs. What lighting, what positioning, what seating, what technology, what grouping, all of these take into place. And there are, many good resources out there for people who work with students with severe disabilities. Again, if you're going to be in a general education classroom, you're not going to be dealing so much with all of that, other than the keeping in mind that students with severe disabilities and their peers without disabilities can both benefit from inclusive education. That part may very well happen in your classroom. So what kind of instructional technologies out there? Well, you've got technology that helps the individual perform the desired skills in the most effective, efficient manner. There's adaptive equipment that can be needed for feeding, for dressing, for toileting. There may be alternative or augmentative communication aids. And all of these decisions as to what technology needs to take place is based on the individualized education plan for that particular child. So again, we're not going to say, okay, this is a severely disabled child, they get X. No, we figure out a program based on their individualized program, and then the assistive technology is addressed through that. So you are a general ed teacher. What do you do if you find out that you're going to have a student with a disability, with severe disabilities, in your class for a portion of a period? What do you do? Well, first of all, remember, as we've said so many times this semester, first and foremost, they're kids. And first and foremost, you need to be a human. Welcome all students to your room. Yeah, it's going to be a challenge. Yeah, it may cause some issues down and then. But, even, quote, normal kids can be a problem. Even normal kids can present issues now and then. Show concern for the success of all students while understanding that success doesn't look the same for all students. This child with these severe disabilities, success is going to look very different than your GT kiddo. Adjust the classroom and learning environment. If you know that this child's going to be in your classroom for part of a period or part of a day, where's the safe place? Where's the place that works for them, where they're part of things that are going on, but at the same time, they are safe and they're not creating issues for anyone else. Implement adaptations and instructions that meet the individual needs. How can you instruct this child? It's not going to be where I can stand up at the board and write down 7 steps and then everybody's going to follow it. That's hard enough for a general ed kid. It's also not where I can just stand up there and say, okay, everybody, read chapter 3 and then do the questions at the end. That's not going to work for a student with severe disabilities. So you're going to have to put in adaptations and instructions that meet the needs of that particular student. And again, that's going to be based on the art committee decision and the IEP that's in place. You want to select effective teaching methods and materials. And what this child is working on in your class may be very different than what every other child